Another disease of abnormal leakage of urine is overflow incontinence. As the word indicates, overflow means urinary bladder becomes distended or filled with urine, and incontinence, abnormal loss of urine occurs. That is overflow incontinence. It refers to incontinence when intravesicular pressure from an over distended bladder exceeds urethral pressure. That is known as overflow incontinence. It presents with continuous urine leakage, dribbling, and incontinence of the bladder emptying occurs. Overflow incontinence, and its causes are diffuser underactivity, means diffuser muscles does not work well with increase in the age, decrease estrogen in postmenopausal age, peripheral neuropathy like diabetes, vitamin B12 deficiency, and alcoholism women can develop this condition. Spinal pathologies like multiple sclerosis, spinal stenosis can cause diffuser underactivity. Bladder outlet obstruction, it causes compression of the urethra, and in fibroids, urinary pelvic organ prolapse, urethral structures, overcorrection of urethra from pure pelvic floor surgery can create this condition with overflow incontinence. Or certain medications can create this condition, like certain medications can cause this condition, like ganglionic blockers, anticholinergics, epidural anesthesia, and spinal anesthesia can create this condition. Now, what are the signs and symptoms of overactive incontinence, overflow incontinence? Overflow is stress incontinence, poor stream, and incomplete bladder emptying, and straining to void is uh, are the common signs and symptoms. How one can diagnose: pelvic examination may show normal anatomy, neurological examination will show decreased pudendal nerve sensation, urine lysis and culture are usually normal but may show infections. Urodynamic studies shows markedly increased residual volume increased. No abnormal and voluntary diffuser contraction occurs, because this is not the cause of diffuser, but there are other causes. So how one can treat? Treatment requires intermittent self-catheterization, discontinue the offending systemic medications, cholinergic medications to stimulate bladder contraction, and alpha adrenergic blockage to relax the urinary bladder neck can help in this condition. So this was our overflow incontinence, in which urinary bladder becomes over active, becomes filled with urine, and we treat this condition by certain medications and surgical operations.